Dr. Joel Selanikio about the MERS virus. He is a physician and leads a company that specializes in mobile healthcare technology. We asked him about the rapid spreading of the virus and whether the world should be alarmed.
Of course, in South Korea, it is spreading, but I think the most important thing to remember is that this is not as infective as Ebola. The reason that they're having transmission in South Korea is because a lot of people who had it showed up at the same emergency room in the same hospital. And it seems that the hospital was slow to recognize the infection risk and therefore to isolate those people. There's no spread in the community at all in South Korea, at all. It's all from the health facility so far.
Is it as contagious as Ebola?
I think the question is still up in the air, but it does not appear to be. Right? It appears to be, they think it may be transmitted by a respiratory route, and therefore that masks and gloves should be sufficient to prevent the spread, as opposed to Ebola, which, as you know, requires the full PPE suit. So they believe it's less infectious.
But it is so dangerous. It's got the highest fatality rate. Well, it's the highest fatality rate compared to Ebola, correct?
Yeah, no, I mean, so far they believe it's somewhere between 30 and 40% fatal, although they're seeing a lower fatality rate. That was from the Saudi Arabian, the Middle Eastern outbreaks that they'd seen originally a couple years ago. It started in 2012. But in South Korea so far, I believe they've had about 14 deaths out of about 140 patients, more or less, which obviously is about 10%. So that's actually quite a bit less than what they saw in the Middle East. And I don't think anyone's quite clear as to why the lower fatality rate in South Korea, although everyone's very happy about it.
So let's talk about, the worst case scenario. We had this in the U.S. a few years ago. There were a couple of cases. There is one case right now that's reported in Slovakia. What are the chances that it would spread rapidly, let's say, if someone came to the U.S. or came to Europe with it?
I think it's really unlikely to spread widely in the United States. One, because we're prepped and ready for it. I mean, everyone's sort of expecting and watching, planes coming from South Korea. It's not like it's impossible for someone to get here, but I think it would be impossible for them to spread it a lot. Again, keep in mind, there's no community spread in South Korea. It seems like you have to be pretty close to somebody who's pretty sick, and that exposure happened in emergency rooms, right? So someone who came here would not apparently, as far as we can judge from South Korea, be spreading this to everybody on the street as they walk down the street.
We know that Seoul is basically a ghost town right now, they're saying. Is that necessary?
I think people are doing what you and I would probably do as well, which is they're minimizing the potential contact. Probably what's necessary is just a gown, not a gown, a mask and gloves. But yeah, people are afraid, and again, the mortality rate has been high. So I would probably be doing the same thing, though I think it's a bit of I don't want to say overreaction. I'm not there, but it does appear that a mask and gloves is sufficient to prevent the spread.
So what did we learn from Ebola, and what did the World Health Organization learn, and what will they put in place after this terrible scare?
Well, it's funny. I remember talking on this show about Ebola and what we needed to do to stop the spread. For example, there were cases in Texas, et cetera, and that's, I think, the first time people heard of things like, case tracking, for example. And what do you know? It's exactly the same thing in this situation. This is outbreak containment 101. You need to identify the people who've been exposed. You need to isolate those people until it becomes clear whether or not they've become infected. And that is what now the South Korean government is doing. That's what the Saudi Arabian government did when they had the outbreaks there. Of course, that's what we did when we had a couple cases of Ebola here. And this is ongoing in West Africa. This is not, we don't have to invent new science to figure it out. The procedure for doing it is pretty simple. What we need new science to find out is exactly how it's transmitted, and of course, to hopefully develop a vaccine or some specific treatment, which we don't have for either Ebola or for MERS yet.